in a way, maybe it's good. And we have known for a long time. A lot of people say, oh, you left a global thing and you came and were working with communities. Gives you a lot of satisfaction. Government is, saying we want to clean the Kuam, and it's wonderful that our rivers will be cleaned and maybe get alive again. Collaboration. One thing is, of course, that every student can become a citizen scientist, and this is something that we saw during the floods in 2015, how the students actually came together. And we shouldn't just be using AI for the sake of AI. Obviously, it has to improve health outcomes, and it also needs to be tested. The digital should not overburden, it has to reduce the burden on the healthcare provider. Chennai is thinking about urban primary healthcare. That will reduce out of pocket.
I want to ask you a little bit about, what it means for you to head the MS Swaminathan Research Foundation with its, history, legacy of scientific and civic engagement.
Well, it's a tremendous responsibility because, like you said,
great power comes
with the name and the legacy of Professor Swaminathan and the expectations and the fact that I am not from the agriculture background, and that's what this foundation has primarily worked on. But I think in a way, maybe it's good that I'm not from agriculture, because I look at things from an outsider's perspective and I'm able to maybe identify some gaps. I can, never going to become an expert in crops or anything like that. But for example, the Women Farmers Entitlements Bill, one of the things that this foundation has a very strong gender orientation to its work. And we have known for a long time that women do not have land in their names. Overall in India, if you see, only about 15% of women's names are included in land ownership documents. It varies a little bit from state to state, but average is 15 to 17%. So what happens as a result is, while the woman is actually the one who does the farming, if you go to any village, you'll see it's the women who are working in the field, except the men come in when there's a tractor to be done or some very hard work. Otherwise, it's only women. But they cannot access any government scheme because document is in the name of her husband. The husband is in some faraway city, and when she goes to the bank or she goes to a government officer, she's told, where's your name? Your name not there, go bring your husband and then we'll see. This means that they end up going to money lenders and so on, and facing a lot of difficulties. So I met Chief Minister Fadnavis. It was a courtesy call, but I mentioned to him this problem, and he immediately picked it up and said, I'd like to do something for women farmers in my state. And I'm very happy that today the cabinet in Maharashtra has approved the draft bill. It will go to the assembly, I'm hoping this week, and I think it will be a historic. My father conceived of this bill in 2011, and when he was a Rajya Sabha member, he actually introduced it in the Rajya Sabha, but for whatever reason, it didn't go through, and the term of the, when the Rajya Sabha term lapses, then the bills don't carry through to the next one. So that bill didn't go anywhere. But we took those key elements of that bill, made some modifications. Now it's 15 years later, and situated it in the Maharashtra context. And so today, I'm just keeping fingers crossed, but I think we're 99.9% there. The assembly has to approve it, and I'm hoping other states will pick up. It will make a big difference to women farmers. We had extensive consultations with women, and so that's one of the things I really enjoy about working in MSSRF. A lot of people say, oh, you left a global thing and you came and were working with communities. Gives you a lot of satisfaction. I love going into the field and talking to whether it's fishermen or farmers, women farmers or tribals. These are the three areas we work in, less in urban. You listen to them and, they've got so much wisdom. They know the land, they know the environment so well, sometimes much better than scientists. And so their insights actually should be shaping policy. And so I feel that the foundation main role we can play is to listen and to take that ensure that it's data driven and evidence based, and then take it to the policy maker and say, if you do this, this will be the impact, this will be the change. And I think politicians and policy makers are looking for that. So if you approach it the right way, I think that our foundations like ours can have impact.
Dr. Swaminathan, how can us Chennaiites, children, college students, really be involved with the work that that the MSSRF does?
Yes, this is something even I've been thinking, like how do we get more citizens? And I see a lot of citizen activism and activity now. I think there are a lot of student groups, a lot of people who've come together to protect water bodies, to protect lakes. I see now government is, saying we want to clean the Kuam, and it's wonderful that our rivers will be cleaned and maybe get alive again. Right now, unfortunately, I don't think our rivers have got any life in them. So we need, I think, more engagement and joint action and collaboration. One thing is, of course, that every student can become a citizen scientist, and this is something that can be done. I think there are people doing it. IIT, for example, has a program on water quality where they get students to measure water quality, of course, after some training and report. And then there's a big database now of national water quality that, the Water Center and IIT Madras has developed. Similarly, I know in other cities that we've had students with air quality monitors who are going around various places, and their air quality reports, the PM 2.5, PM 10 are being uploaded. And that's something I'd like to do here in Chennai, to see over a period of time which are the parts of Chennai that are more polluted and what are the causes of those pollution and how do we help. So we've got a project starting now on landfills, because the solid waste management is a huge issue for all cities. And if you look at the satellite maps, you'll see a huge methane cloud sitting over Pallikarnai and the Kodangayur, the two big landfills that we have around Chennai. So you can imagine for the people who live in that area, what they're breathing, and apart from that, it's also contributing to global warming. Methane is a very potent greenhouse gas. We don't often talk about it. Plus there are nitrous oxide, sulfur dioxide, and so on, ozone, very harmful for health. And so when I go to these places and I see still the rag pickers and the way they are working on those dump sites, it's very, very, I think that really something that we should not have at all. It's like people going into sewers to clean. I think it's high time that we mechanized these things and cannot expose human beings. So environmental issues which impact our health in a big way is one area where we all need to come together, whether you're a doctor or a student or an engineering graduate. There is something everyone can do. We saw during the floods in 2015 how the students actually came together, and overnight there were apps created. There was so much of data collected. It was really helping people. So it's like COVID. When there's a mission, people come together. I think the problem gets solved, and maybe it's the right time now, Chennai, and there's a lot of progressive environmental action being taken by government that we should all contribute.
I love this idea of the citizen scientist. I'm just want to ask you a question really about how Chennai is, on the one hand, racing ahead with digital health and AI in hospitals. How will Tamil Nadu, do you think, really ensure that this tech revolution doesn't become a two-tier sort of system where the urban, the privileged English-speaking patient benefits while everyone else is really left behind? And what guardrails would you insist on right now to protect privacy and clinical ethics?
So that's quite a complex question, because when it comes to AI, there are many aspects to it. The way I see it is that AI or any new tool or technology, whether it's digital or something else, should improve the outcomes. We shouldn't just be using AI for the sake of AI. Obviously, it has to improve health outcomes. And it also needs to be tested. In the same way that we would test a drug or a vaccine, we should test both the safety and the efficacy. Like we can introduce a chatbot tomorrow, and there are already many chatbots, and now they're in different Indian languages thanks to the developments in India. Sarvam and Bhashini and all, we can actually do chatbots in spoken local dialects. So you can reach a lot of people, provided of course they have a smartphone. I think we still have a lot of people who don't have a smartphone. So that's where your digital divide can come in. Again, you're leaving behind those which are already left behind, the elderly, the disabled, or the people who don't have the phones. But I think that there's a huge opportunity here as well to use digital and AI in ways that can help the public health system actually deliver care, to target people and so on. So ultimately and ideally, we will have a population health register where everybody will have their a family card or something like that, where all the issues of that family will be there, and then you can track digitally and make it easier for people to get tested and to continue with their treatment, because now you have to spend time going to the hospital, queuing up, getting medicines. You probably lose your day's wages if you're a daily wage labor, but now you can do all this much more efficiently and be able to track people through telemedicine and these other platforms. So make it more convenient, make it more efficient. But at the end of the day, I think it involves a lot of thinking and planning for the system to be really good, because we've seen any number of digital systems which don't serve the purpose. Or the other danger is a proliferation of apps. So when I go and talk to people in the field, the frontline workers, some of them are filling 80 registers in a day and now 15 apps. So the apps have not replaced the register, that we're still getting them to fill the physical register, but now also every program has an app. So this is not done because these workers are only spending time in filling data. They're not able to spend time with the patients, which they're supposed to do. So that is where I think the digital should not overburden. It has to reduce the burden on the healthcare provider, particularly in the government. And see, the private hospitals are using AI quite well, especially to look across their data and to get a lot of insights and to look at outcomes and standards and things like that. But in the public system, first we have to create the database. We don't have a digital database of patients. Then you can start doing the tracking and the monitoring and the support, right, and so on. And also it would really help the government to know what's happening. Like simple thing like death records, okay. In India, we have very, very poor cause of death reporting. Only 40% of people are seen by a medical practitioner before death. Majority of deaths are happening unattended by a medical person because it's happening at home, and especially in the rural areas. So there's no, but even where there is a doctor attending the death, and I think the students should tell me, what cause of death do you write? There is a scientific methodology of writing down the cause of death. Nobody's trained in that. And so we write cardiac arrest. So everybody dies of a cardiac arrest, obviously, because heart has to stop in the end. But that's not, we want to know what happened to the person. We don't know. In every high-income country, by looking at that death thing, you know exactly what your burden of disease is. How many people are dying of what disease. And so you can formulate policies. Here we have to do a lot of extra work to find out. Verbal autopsies, it's called, you do surveys and so on. So there's improvements that need to be made there. And again, digital can really help us. AI can really help us. So I think we need to identify the key gaps. That where do we have data gaps? And can we use AI? But over-reliance on AI, you talked about, firstly, the digital divide, and secondly, we can land up in trouble. We know that chatbots can go wrong. Particularly, they can give wrong advice, so they have to be very closely monitored. For mental health, I've heard stories about chatbots actually, telling people how they can take their own life and so on.
Yeah, mental health and
mental health
is a very, very big.
There are good ones and bad ones. So, one has to be very careful. You have to evaluate. You have to know exactly what you're using it for. And they cannot replace and will never replace, I think, health professionals. Yeah.
I just have one more question for you, Dr. Swaminathan, before we have a rapid fire round and I open the floor for questions. Like I mentioned, Tamil Nadu is hailed as a healthcare success story. Yet, catastrophic health expenditure still pushes, like we talked about, the poorest into deeper poverty. What bold headline making experiment in inclusive community rooted care would you pilot in Chennai that you believe genuinely changes this in the next 5 years?
See, a lot of outpatient care is what is contributing to the out-of-pocket expenditure. Because our health insurance policies basically cover inpatient care. So the first thing to do would be to ensure that we make it easy and accessible at the right timings, the right place, etc. for government-run clinics, so that people can walk in for minor ailments, and also they'll get better quality care, and like you can avoid unnecessary antibiotics and things like that. The other thing we have to do is, like, there has to be a better governance and stewardship of private hospitals. You cannot charge anything you like for any disease, So there has to be the Clinical Establishment Act exists, but it's not well implemented, and so that has to be done. During COVID also, when things got out of hand, then the government put some rules, saying you can't, and there was an unnecessary over treatment and over investigations, and today we know a lot of corporate hospitals do that. That's the trend now, and that's increasing. So this over dependence, just because we have a government health insurance that you can go to a private hospital, there's a perverse incentive for the private hospitals to jack the bills up. And everybody knows this. So I think the insurance companies and the government need to come together to really make sure that the system cannot be manipulated and played. But most important is primary health care. If you had a government clinic open in every little neighborhood, which Delhi tried, they called it the Mohalla clinics, where you could walk in, you could have a simple, quick exam, consult with a medical doctor, get your medicines and go. And if it's more serious, then you are referred, to a hospital. And in the rural areas now, we've got the sub-centers, what are called the health and wellness centers. For every 5,000 people, we've got a health and wellness center. Urban, we still don't have. So I think Chennai is thinking about urban primary health care. That will reduce out-of-pocket expenditure, but we also need health literacy. People should not self-medicate. They should not go and just to the pharmacy, buy some medicines and eat them for no rhyme or reason, particularly antibiotics. So there's a lot of over-medication that can be avoided.
When is the last time you did a rapid fire? Okay, we're going to put you on the spot now. If you had to describe Chennai in 3 words from the vantage point of your life in science, what would they be? 3 words.
Strong institutions, collaboration, and excellence.
Fantastic. What is a perfect Soumya Swaminathan day in Chennai with no meetings, no travel? Where would you go? What would you eat? And who would you hope you'd bump into?
Well, I would certainly like to do more cultural activities if I had time. So I love listening to all kinds of music. And so whenever the Kalakshetra festival is on, of course, we go there, but also look for plays. I think it's, we don't have as many perhaps as theatre. Mumbai or Bangalore have much more,
So much more,
or Delhi. And having grown up in Delhi, especially in the season, which starts around October and goes till March, almost every evening you could go and listen to a music concert or attend a play. So that kind of culture, I hope it increases here. You have to really look out and wait and watch. So my ideal day would be some time spent outdoors. So either walking in the Theosophical Society or on the beach. Some time spent maybe listening to music, reading, and of course with friends.
Lovely. If Chennai were a patient you were treating, what diagnosis would you give it today? And what prescription would you write for its future health?
I think Chennai has become obese. It's literally and figuratively. I think firstly it's expanded so much, so it's become huge, and we have such a large peri-urban area now. And second thing is literally that, there's no place to walk and to exercise. And the public transport is not yet enough for everyone to be able to take public transport. So again, very happy that Chief Minister is now really putting a lot of emphasis on expanding the buses. And I think he mentioned air-conditioned buses, which are a necessity for Chennai. And Supreme Court has said the pedestrian should be able to walk. So I try walking whenever I can, but it is a nightmare actually. It is very unsafe and it is not easy to walk. Even if the distance is short, it is impossible to walk from one place to another in Chennai. Right. And that needs to change. And I hope some parts of Chennai can become completely pedestrian. Without transport.
Yeah, we're really hoping for that. Tell us one Chennai memory that you find yourself returning to, especially in tough moments. A street, a conversation, smell, rainy evening.
I think the drive-in Woodlands, when we used to come which is not there now. We used to go there for breakfast, regularly when we came for holidays. And Elliott's Beach in those days was a big adventure.
Yeah.
So, because it was completely beyond the city limits and, it was deserted and we were not allowed to go there after a certain time and all that. Yeah.
Just finally, one last question. If you could gift Chennai one new public health habit and erase one old unhealthy habit overnight, which two would you choose?
Well, I think spitting and urinating in public, this has to stop. I still see it happening, and open defecation as well. And maybe that's something, especially I live on the beach. So when I walk on the beach, there is a lot of open defecation going on, and we need to sort it out. We need to construct more toilets and also, of course, bring about that behavior change. That's really something which is very bad for the health, particularly of children. And the new one I would like to see is more pathways, more urban greenery, more parks, so that people can have their evening walks and also relaxation. There's a lot of evidence to show that if you spend some time in greenery, that your blood pressure is better, your mental health is better, many things are better. Right. So, and the Japanese, of course, have this thing of forest bathing, and now there's science behind the forest bathing also, that there are chemicals that you get from the trees that, reset your system. So it's not just a nice, again, it's for the health of the public as a whole. I think investing in those spaces is very important.
Right. Super Chennai, I'm sure you're listening. So we'll take a few questions from the audience.
So, good evening, ma'am. So, basically my question is, what does this warming planet mean for the kids growing up today? So, as a pediatrician, so basically in terms of their health, and how we, the present generation, can tackle these risks that's coming up.
Very good question. Difficult to give a very short answer, but yes, impacts children in many ways from birth. So women who are exposed to high heat during pregnancy, we know now that they have smaller babies, they're not growing as well, and so on. And if you have heat and air pollution both, then it's a double whammy. So many of our cities actually have that. Then, of course, as the child is growing, extreme heat impairs learning. So if you are sitting in a classroom which is very hot, that child is not going to learn. So it's going to impact learning. Obviously, it impacts the outdoor play and so on, which again in Delhi we see during air pollution months, the children are told to stay indoors and not play. That play is a normal part of childhood. So if it's heat or air pollution and that is impacted, that's going to affect everything about your development. And mental health. So I've got psychiatrist friends who've told me that they meet youngsters who have nightmares because there's so much on climate change that they see on television and these very dramatic and very scary things that they wonder what the life is going to be like. They really worry that there'll be disasters and they won't be able to have a happy life. So there is also something called climate anxiety that there's a scientific word for that, sosastalgia it's called. So what can we do? Yeah. So I think that young people have to take our generation to task and say that you are ruining this world. After all, we are the ones who are allowing all this to happen, fossil fuels continuously being used and deforestation. So, global warming is, of course, leading to extreme weather events. Last year, every day of the year in India, in one place or the other, there was an extreme weather event. Either it was extreme rainfall, or it was a flood, or a drought, or an extreme heat event. There was not one day where one place in India was not impacted. So, many things which we are doing today is we're not thinking into the future, the way we are building our cities, the materials that we are using, the blasting of mountains to build 4-lane highways in the Himalayas. The Himalayas do not have that carrying capacity. We cannot blast our way through the Himalayas just because we want to take 1 million people, to have a holiday. No, it doesn't have the carrying capacity. So ecological reality has to be kept in mind, and I think young people of today are very aware of these things, and they don't want things to be done the way that we're doing now. We've seen both global movements, people like Greta Thunberg, but also within our own country, we see so many young people. That gives a lot of hope to me. But your voice has to be heard much more strongly. I think it started now. Young people's voice is being heard. So that has to continue.
Thank you so much, Super Chennai, for this session, and thank you, ma'am, for this and many more things. So, shortly, I'll keep it off. And so, when I finished my medicine, one of my biggest guiding factors into public health and community medicine was your book. And my primary research is on tuberculosis, so I've read. You're part of my literature review, so I've probably read everything that you've published. Ma'am, my question is short. It's based on what we call antibiotic resistance, but I want to talk about the concept of over-the-counter antibiotics, where every day as a general practitioner, when we practice, there is one odd patient who's still coming with 2 tablets of Norflox because they directly went to a pharmacist, or there will be some doctor who will be over-prescribing them antibiotics in the wrong protocol. So, according to policy, I think we have capped it. We have told all pharmacies that this should not be done, and I don't think anything else can be done with respect to policy making. But what else can we do to prevent people from doing this? To prevent, apart from proper information, education, and counseling, what else can be done to get this better and implement this?
See, many times we have policies, but they're not implemented fully, right? So I think as far as the pharmacies are concerned, it's an implementation of the policy, and Kerala has done it very well. So I think we should all take a lesson from Kerala. They have both given a carrot and a stick. So you can incentivize the pharmacists to do the right thing, but you can also strike them off the roll. So they have said they will debar them if they see that they have prescribed any Schedule H drug, which includes antibiotics, without a prescription. And today with digital, you should be able to track and monitor. Kerala has gone a step further. They have also said they'll collect all the expired antibiotics so that they can be safely disposed, and people don't have to throw them here and there. Then the third thing they've done is they have, of course, they have a very strong panchayat system. So their community engagement is very strong through the panchayats and local urban bodies, and so they've been able to create a lot of awareness among people. So antimicrobial resistance is something that there's no one silver bullet. You'll have to do 3, 4, 5 things, including strict action on pharmacies, hospitals. Every hospital must have an infection control committee. Antibiotics use has to be monitored, and it does make a difference. Once you start monitoring and you make one person responsible, then you start questioning whether there is a need, and public awareness has to come. So we have to do all of these.
I'm not from the medical background, I'm just from the tech background, and I have this question for you. So, post COVID, we see a lot of cardiac related diseases. So, often we see people in limelight are affected by some cardiac related disease, and this discussion arises: is it due to the COVID vaccine or not? So, is this just a myth, or like has COVID vaccine has any impact on cardiac related diseases?
The myth is that COVID vaccine has caused this problem. The actual reality is that COVID itself increase the risk for cardiovascular disease. So, but Indians have enough risk factors. We don't need COVID or any other risk factor. We've got diabetes, we've got hypertension, we've got obesity. If you see the latest NFHS data, you'll see obesity, unhealthy food, ultra-processed diet, everything, sedentary lifestyle. So you don't need any other risk factor. We've got everything. COVID infection, if those who had severe COVID especially, or those who had repeated COVID, does increase the risk of cardiovascular as well as stroke because it caused a lot of inflammation at that time. COVID vaccine, there's no evidence that it was linked with many studies have been published now, showing that it was only protective. It did not increase the risk of any of these. So that was a big myth, and it's an anti-vaccine group that has been spreading those stories.
You were the first chief scientist of the WHO and COVAX family, COVAX facility co-leader, and DG ICMR also. How, as a woman, we are almost crossed to 2 decades to get education and career-wise growth. How did you manage in that positions, and what are the advice we are need from you?
In fact, I was thinking about the other women from Chennai who are in the medical field who are very inspiring. Of course, Dr. Shanta, Cancer Institute, and Dr. Sharda Menon, SCARF. And they, again, ahead of their time in those days, to have done what they did. And Dr. Muthulakshmi Reddy, of course, was the first. So to come to your question, yes, I think that the first thing is that you have to have self-confidence that you can do everything that a man can do and that you're no less. And that societal barrier is still there because there will be people in society, in the family or friends, saying that you're a woman, so you should be content with this, especially when it comes to professional choice. When you have to make a decision or a choice between family and profession, generally the advice will be choose family. Profession is something that you don't need to worry about. So, from my own experience, you can do both, and you can do them both well, and you don't need to feel guilty. The main thing, what happens is people start making you feel guilty that you are neglecting one side of your responsibilities. The other is that you have to be bold and willing to speak. So even in my own case, when I first started going to Delhi, when I was a young researcher, a young scientist, I would find it intimidating because the room was full of older men and they would just ignore me as if I wasn't even there. So my opinion was neither sought nor listened to, nor. So I in fact came back, I told my director at that time, Dr. Narayanan, I said, you please go for these meetings in Delhi, stop sending me. It's a waste because no one's listening. And if you go as a director and as a man, they'll listen to you. And he said, no, you're the expert. You have to go and you have to keep insisting your point, and so one day they will listen to you. So I also had that support from my director who kept pushing me and saying that you know more on this subject than others, so you have to go and represent yourself and speak over there. And you need, of course, supportive family. If your partner is not supportive and your family is not supportive, whatever you do and however great you are, you will not be able to go ahead in your life, because it's very hard, at that time to make those choices. So, yeah. So I hope that, in this generation, that men and women will look at, and I see many examples where the man has decided that he wants to stay at home, look after the children for some time because the woman is in a very critical stage of her career and things like that. So it is changing, but very slowly, because you still see on the top level, the leaders are mostly men. Yeah. The women go to a certain level and then there's a plateauing. So one thing that I'm involved in now is the leadership building, the leadership skills building at that level of mid-career. Very important, so that you feel confident that you can compete for that next big job. Because women often put ourselves down. We underestimate ourselves and we say we're not good enough. There must be lots of other people who are much better than I am, so let's not apply for this. So even in my case, there have been such times when somebody has told me, one of my seniors has said, you are the right person for this job, apply for it. Though I myself felt that I was not ready. A man would not think like that. So, yeah. So this is why you have to support each other, so that leadership skill building is also important. Now there are training programs that have started, not enough, but we need many more, so that we can see women leaders coming in all.
I think, Dr. Swaminathan, you made this really interesting point early on in our conversation about how your mother started the first creche, right, for everyone. And therefore, you talked about how unless systems are enabled for women to be able to do these things, even in the corporate world, it's extremely difficult for women to, go up the ladder, because if they have children or they have aging parents, invariably caregiving is still a woman's role. So I think systems have to be enabled for these things to happen. So
It used to be only children, now it's also elderly.
exactly.
Because we're all living longer, and so the woman also then expected to look after the elderly relatives. Yeah, so now we need care for children and care for older people as well.
People as well.
The
Yeah.
state has to think about that. And you're right, it's corporate and everywhere,
Yeah.
public and private sector.
No, absolutely. Yeah. We will take your question offline if you don't mind. I'm going to please request Mr. Ranjit Rathod, Managing Director, Super Chennai, to please say a few words.
Yeah, no, that's good. First and foremost, thank you, ma'am. Thank you so much for joining us today and having an engaging conversation as a part of Super Chennai Arattai. And thank you, Akila, for moderating the show. Thank you to the guests who have come here. So lots of things have kind of related to my own journey. I myself was diagnosed with tuberculosis when I was in UK, and I became more like a research subject because they were not used to tuberculosis till I called up my GP in Chennai, and he gave me 4 tablets for 9 months. That's it. I had a cold abscess which they removed, so I could relate to that. And all through the journey, lots of things which you have said is kind of bringing memories, including very recent memory of my son trying to build an AI out of SFO. And he says that why is India so protective about their data? Can't they put an ethical committee and just allow the data to come out? We can cure all the diseases. So, but there are limitations. We have to work with the policymakers and everything related to this particular conversation. And to the larger audience, what we are trying to do with Super Chennai is a body created by CREDAI, which is more of a developer's body. But we are trying to bring a sense of pride and rebranding to the city of Chennai. That's why we are probably coined as Super Chennai. We believe that we should not rest in old glory, the past glory of just 3 metros, which were prominent and business talent came in by itself. However, things have changed in this era. Now we have many more cities, which we all know, where it could be Bangalore, Pune, Gurgaon, Hyderabad, and we are competing for good reasons. We are all competing with each other to excel. In such strive, we believe that we need a rebranding, marketing, bringing Gen Z millennials, because the future belongs to them. Our era probably might end in another 10 years. But what are the opportunities which we can give to the Gen Z and the millennials is the question mark which we have in our mind. And that's why we thought that we'll engage with the public, with the government, with media, with the entire ecosystem on all the 5 pillars. Work here, live here, visit here, invest here, innovate here. All the spectrum we want to cover. And that's why this engagement has started. And we have an able CEO, Karthik, who's leading this Super Chennai initiative. We are covering various aspects. One such is the Super Chennai Arattai, where we are having engaging conversation with inspiring people like Dr. Soumya. Apart from that, we have something on the entertainment side, something on the invest, something on the job side. So please visit our website or our digital handles. We have close to 1.4 million followers across all our digital platforms. Follow us, give us ideas, and be part of this initiative so that it becomes a real citizen-based initiative where the voice is heard. And if the voice is heard, as ma'am said, today we have seen that the voice of Gen Z is being heard. And that's why we have a new CM as well. So the voice will reach out to the right people and right policy changes will happen. With that note, once again, I thank you all and thank you everybody for being here.
I'd now like to invite on stage Mr. Chella Krishna, partner SRSV and Associates, to please say a few words.
Oh, thank you. I'll be very brief. I don't want to take much of your time. Thank you, ma'am, for addressing us. You have been brilliant. You have been at the forefront of healthcare and impact. You have been at the WHO and you have managed to see impact at scale. You have managed to, you are carrying the legacy of the MSSRF, which perhaps is one of the most important institutions to ever come out of India. The ability to problem solve for something like food is something that we did not even think about many years ago, and that was done by this prestigious institution. So therefore, to solve health is another step, but I'm sure it is possible within the realm of what we see. Ma'am, to us you represent curiosity, you represent collaborative effort at the intersection of the most important C, which is compassion. If Chennai can get someone like you to be born here, to come here, to live here, and to work here, that's 90% done all the way. So we are very happy that you could join us. And for us, Chennai is already succeeding when people like you are here. You are our brand ambassadors. So thank you very much.
Thank you very much, Mr. Krishna. I'd like to now invite both of you to please felicitate upon Dr. Soumya Swaminathan, the Icon of the Month Award. Super Chennai Icon of the Month being conferred on Dr. Soumya Swaminathan. Big round of applause, please.